Dr. O'Connor, this video is about Dianabol. What is Dianabol?
Dianabol is the first oral anabolic steroid produced in the world, known as the breakfast of champions. It goes back to 1955 when it was first described. The generic name of Dianabol is methandrostenolone. And the classic historic story is that a team physician for the U.S. Olympics named John Ziegler witnessed the Russians in 1956 at a competition having problems as they were using testosterone suspension intramuscular injections with urinary retention. And he actually witnessed, supposedly in the back training area, one of their athletes having to be catheterized because his prostate was enlarged from the use of testosterone derivatives. So that's where it started. He went back, though, from this training in 1956, 57, and he was interested in using and producing some of these agents called anabolic steroids. And no one knew. They weren't really called them at that time, but he thought that he would want to use an agent like this. And so he started to work with a pharmaceutical company named Ciba. And he did that, and in 1958, he produced Dianabol with Ciba. And at that time, they introduced it into the market in 1958. And what they did was they produced the first oral steroid from testosterone derivatives that were produced and discovered really back in the late 1930s, 1940s. They were using suspension, testosterone suspension. And they realized that they were anabolic versus androgenic effects. And the androgenic effects are male secondary sex aspects that can be enhanced by these drugs, virilization, if you will. And that's what they thought led to the prostate enlargement. So they wanted to minimize that. They wanted to maintain the anabolic effects. This is anabolic steroid science, and they want to minimize the androgenic effects. So they did that by the classic 17-alpha alkylation, and that's what made an oral anabolic steroid in that day. Interestingly enough, this steroid is also produced in veterinarian type methodologies with intramuscular liquid suspensions, and it's since been made actually in dropper formulations. It's counterfeited all over the world. And so that's the 1958 when it's in the market. 10 years later, 1967 or so, Dr. Ziegler condemned the use of this drug because he saw over a 10-year period that it was massively abused, and he must have actually had regrets himself, I think, in historical remarks and books on Dr. Ziegler. He regrets being part of this and producing this anabolic steroid that today is still one of the most widely used massive anabolic steroids in the world. By 1983, Ciba withdraws in the U.S. market, secondary to the fact that the U.S. government was asking for documentation for medical purposes of this drug. And they really couldn't come up with any at that time except for treating people that had catabolic states and even osteoporosis in women. But the side effects obviously placed this medication into a point that it currently stands today, obviously, where the side effects far outweigh any possible medical benefits.
Dr. O'Connor, tell us what are the benefits of Dianabol?
So the benefits of an oral or intramuscular anabolic steroid obviously are going to be muscle preserving, muscle building. And it stands today that we need to work on developing an agent for people that are suffering from muscle wasting diseases, either from cancer and cachexia and the standard age-related sarcopenic condition. For as people get older, they become sarcopenic and they lose muscle mass. They become weak. Old people fall and they can't get up. So those are the benefits. It's straight muscle building.
So how much muscle and strength can one user gain on Dianabol?
Well, Dianabol that's the old-fashioned drug that's even still used today. So Dianabol initially by the manufacturing grade recommendations was 2.5, 5, and maybe 10 milligrams a day. Using that, there was great gains on that, actually. Amazingly, the gains itself are dose dependent, and it can go up now to today where it's up to 30 to 50 milligrams a day, and even more. Obviously, the side effects are going to be horrible. And great gains, unbelievable muscle gains. I mean, this is the medicine that people use independently or with other steroids, and you gain mass, you gain strength and size. All the powerlifters that come to see me across the world for over a decade, as I do, what I do as an expert in anabolic steroids, is you see that the initiation is always with Dianabol.
So talking about side effects, tell us more about that.
So this is the problem with oral anabolic steroids or intramuscular steroids, that the side effect profile can be horrific, obviously dose dependent and man per man dependent, not to mention women have side effects too. Side effects are secondary to the aromatization, secondary to the shutdown of the hypothalamus pituitary gonad axis, secondary to the oral aspects of the 17-alpha alkylation and the hepatotoxicity, and secondary to the side effects in the coronary artery potential progression and what it can do to the heart and the endothelial blood vessel disease through multiple mechanisms where it can cause hypertension, it can cause fluid edema. Again, unknown if that's secondary to aromatization. This is a drug that it was very strong aromatizing drug where it converts to estrogen, and you can get puffy. That can lead to all sorts of medical issues, and hypertension and degradation of issues with the heart and cardiovascular system. Not to mention the urinary system. It is less androgenic than testosterone, but it's still androgenic, and you're still going to have gynecomastia, still going to have hair loss and effects in the prostate. I've seen men with significant urinary tract issues from this drug alone.
Is Dianabol legal?
Dianabol is definitely not legal, obviously, since it was withdrawn from the market in the United States 1983. And then subsequently other steroids were removed in the 1990s, and in America there has been a ban essentially, and where they made anabolic steroids a controlled drug, and you have a very limitation for how we can use these, mainly for hypogonadism, for male hypogonadism. This is testosterone derivatives. So it's absolutely not legal in America, and it's not legal in most countries in the world. And it's not legal not because of the cheating, it's not legal because of the medical dangers.
Last question, Dr. O'Connor. How much does Dianabol cost?
Dianabol is actually one of the cheapest anabolic steroids produced in the world. The raw ingredients are actually very simple to make, supposedly, and it will be flooding to the market because it's very cheap and it's very effective. So that's a very good question.
Thank you, Dr. O'Connor.
Thank you.